Hi, my name is Jessica Fish. I'm adjunct faculty with College of DuPage's Department of Nursing. I'm here today to demonstrate urinary catheterizations for males and females. Let's get started by taking a look at a patient's chart. I have Morgan Brown, date of birth August 4th, 1970. Medical record number is 278884. And I'm looking right now for an order for insertion of Foley catheter. And I see that I will be inserting a Foley catheter if my patient is unable to void 6 hours post-op. When we go in to discuss the plan of care with the patient, we'll make sure that she has not voided more recently. I'm also looking for allergies, most specifically allergies to shellfish, any betadine or iodine products, or any latex products. I see that my patient does not have any known allergies. Let's go and gather our equipment. I have sets of sterile gloves. Now, when we look at the urinary cath kit, we are looking specifically at the expiration date, make sure it's not expired, and we're all good to go with that. And we're also looking at the size. I have 14 French here, and 14 French to 16 French is appropriate for a female, and 16 to 18 French is appropriate for a male. Okay, let's go to our patient's room.
Please do not forget your 5 moments of hand hygiene, which are 1. Before patient contact, 2. Before any clean or aseptic technique, 3. After body fluid exposure risk, 4. After touching a patient, 5. After touching a patient's surroundings. Hand hygiene is an important step to decrease catheter-associated urinary tract infection.
Hi, Mrs. Brown. My name is Jessica. I'm going to be the nurse working with you today. How are you today?
Fine.
Good. I have some questions for you. First of all, what is your first and last name?
Morgan Brown.
Okay, and what is your date of birth?
8470.
Good. And I'm just going to be checking your medical record number with what I have. 278884. Perfect. Okay. And let me just make sure that you don't have any allergies. Do you have any allergies that you know of?
No.
Okay, no allergies to shellfish or latex products or betadine or iodine?
Nope.
Okay, great. So let me ask you, when was the last time that you urinated?
Oh, I think last night.
Last night. Okay, that was a little while ago. What I have is I have an order for urinary catheterization. And what that means is I'm going to be inserting a tube inside your urethra, and it's going to be sitting in your bladder, and it's going to help drain any urine that you have in there. Okay? The procedure should just take a couple of minutes. Do you have any questions for me?
Is it going to hurt?
What you might feel is you might feel a little bit of pressure, but I'm going to walk you through all of the steps, and I'm going to have you take a couple of deep breaths right before insertion. That should help with any pressure that you feel. Okay?
Yeah.
Any other questions?
Nope.
Okay, let's get started. I'll walk you through it. First, I'm going to be raising the bed to a working, comfortable position. The first reason is for inspection, and the other one is to cleanse. And I have to do hand hygiene right away after that. Okay, and we're going to start off with peri-care first.
Perineal care is an important step for both male and female. Wash perineum with soap and water, then dry the perineum completely. For female, wash perineum with soap and water from front to back, as washing from back to front can increase urinary tract infection. Then dry the perineum completely.
Okay, so peri-care is done. Taking my garbage and my gloves, and I'm going to throw them away, and I have to do hand hygiene right away after that.
Okay, you want to hang your urinary drainage bag at the side of the bed. Ensuring that it's not connected to a railing that goes up and down, but it is lower than the level of the patient's bladder. Then just bring your tubing up, coil it on the bed, and connect it to the sheet. It can sit there until you're ready to connect it to the Foley catheter.
And our next step is getting everything ready for our sterile gloves and positioning the patient. Now, when you position the patient, you want to be positioning her in a lithotomy position, so knees up and legs separated. You do that so then you can have a really good sterile field. Okay, I'm just going to be helping you move your legs a little bit. How are you doing? You're okay?
Yeah.
Okay. And I have to do hand hygiene right away after that. So I'm going to place my kit right there. Right there. Okay, and I have my gloves. I'm going to do that right there. So now when you open this up, you want to reserve the bag for a garbage bag. And there's a certain way that you can do that. You don't want to kind of rip it too much, and you kind of want to shake that out so you can keep the inside of the bag sterile. So you see I'm going to do this so the inside remains as sterile as you can have it, in case you want to use this as your garbage bag. And I'm going to put that right over here. I'm going to get rid of this. But when you get started, you want to open up the fold away from you first. And then you're going to do the side. And sometimes you might have a corner fold back on you, and you just want to pull those very tight there. And you also want to take care not to touch the inside. And remember that when you have a sterile field, about 1 inch border is not sterile, okay? Now, as you are practicing this, make sure you practice your urinary catheterization skills, but also your sterile glove skills as well, because that's equally as important. Okay, Mrs. Brown, how's it going?
Okay.
Good. Okay, now once my sterile gloves are on, I will not be having my hands go below my waist or anything such as that, okay? And I have my first drape here. You're going to see a shiny side and a not shiny side. You want to have the shiny side down. This does not absorb water, so if the patient were to urinate or if you were to spill water from the syringe, then it would just kind of bead up. But what you need is wrap your hands around the drape, such as that. Okay, and then you're going to ask the patient just to kind of scoot up a little bit, and you want to place that underneath the patient. And then this is the fenestrated drape. We will be using the fenestrated drape. This provides more privacy for the patient, and it also expands your sterile field. Okay, now I have the iodine swabs. Then I also have lubrication. Okay, I have my 10 cc's of sterile water, and what you're going to need to do is pop that back in order to kind of break that seal there. Okay, so what you want to be doing next is you want to attach the water syringe to the balloon port. Now, you do not inflate the water into the balloon port. That can stretch out that catheter tip, so you just want to make sure that that is attached really well. Good.
I am gonna open betadine swabs.
And I have 3 of them. I'm going to place them right in here.
If you do not have betadine swabs, then use sterile cotton and sterile forceps to hold this cotton. Then I have my sterile lubricant. This lubricant is also sterile from outside, so I can touch it with my sterile gloves.
Okay. And now I'm going to take this plastic protective wrapper off the tip of the catheter. So you want to have good control as you're doing that. There's also a perforation on the side of this bag that you can rip that perforation, or you can control it this way too. Either way works. And I'm going to have my catheter sit inside that lubrication. Okay, and at this point I take a look at my equipment, and I have my swab sticks, I have my water attached, and I have everything with my lubrication. So I'm all set to go. Now what I'm going to do is I'm going to make my non-dominant hand contaminated. So I'm going to place this hand on the labia because I need to be able to visualize, fully visualize the urinary meatus. I'm going to leave my hand here until after the catheter is placed. Okay, Miss.
First, I'm gonna disinfect with betadine swabs.
You're going to go on the side that is farthest to you, and you really want to exaggerate, over-exaggerate the removal of that, because you do not want that swab, that dirty swab, over your sterile field. Okay, so I'm over-exaggerating that. So I did the side farthest away, then I did the side closest to me, and now I'm going to go down the middle. And once again, you're going from top to bottom, and I'm over-exaggerating that.
Let betadine the contact time at least 2 minutes to dry.
We're ready for insertion. And something else, you want to have about 2 to 3 inches away from the tip of the catheter. If it's too close, then you might break a sterile field by touching that. And then if it's too far away, you're not going to have good control over that. So I like to go about 2 to 3 inches away. Okay, Mrs. Brown, take some deep breaths for me, okay? Perfect. Good job. Now we're going to be inserting until we see urine. And once we see urine, we're going to go about 2 more inches. Okay, Mrs. Brown, I see some urine. I'm going to go 2 more inches. You did really well. At this point, I'm going to hold on to that. I'm going to anchor that catheter in place. And now I can insert my water. Very good job. And then I'm going to give a little pull just to make sure that it's sitting in the bladder okay. And it does. That feels good. So now I'm going to detach that. I'm going to remove that.
Once the urine flow has decreased or stopped, I will connect it to the end of the drainage tube.
And then I'm going to be attaching the catheter to the StatLock stabilizer right here. I'm going to make sure there's a little bit of a slack as well. She did very well. And I'm still checking on that urine. I see about 400 cc's of light yellow urine. Very good. Okay, and I will dispose of properly. All right. And then last thing before I leave, going to be using hand sanitation. And that completes our skill for urinary female catheterization. And same with as female, I'm going to be ready to demonstrate male urinary catheterization now. Now I have my non-dominant hand, and I'm going to be placing that on the penis in the upright position, perpendicular to the body. And this is going to be the position of my non-dominant hand until the catheter is inserted. Okay, Mr.
I am just gonna be disinfecting with betadine swabs.
Once again, you're focusing on the urinary meatus. And you really want to have that wide area, that you don't want to be close to that sterile field at all. And then one more. Mr. Brown, I'm going to have you cough and take some deep breaths. Once again, good. Once again, I want to be about 2 to 3 inches away. Okay, deep breath. Good. And if you feel any resistance at all, you would need to stop and let the provider know immediately. Now, with insertion for males, you're going to be going up to the point of the bifurcation. And then you're going to be anchoring that in place once again. Okay, then you give a little tug just to make sure that that is sitting well right in the bladder, and it is. Excellent. You did very, very well, Mr. Brown. Mr. Brown, you just got an order for removal of the urinary catheter. So we're going to go ahead and remove that for you. Does that sound good?
Yeah.
Okay. And actually, before I do that, and this is not a sterile procedure. So all I'm going to need is my 10 cc syringe for removal and gloves, and then we're all set. So now this is not going to be as uncomfortable as it was with insertion, okay? So what you want to do is you want to undo the stat lock, and you want to take out as much water as you put in. And you always want to pinch the tube a little bit, just in case urine comes out as well. So it should really kind of be flowing out on its own here. That looks good. Okay, deep breath for me, Mr. Brown, okay? Good job. Thank you very much, Mr. Brown.
All right.
Okay, and that's removal of a catheter.